Narrative Therapy in Sports by Anthony Thomas. What is narrative therapy? Narrative therapy is a form of psychotherapy that seeks to help patients identify their values and the skills associated with them. It provides the patient with knowledge of their ability to live these values so they can effectively confront current and future problems. The therapist seeks to help the patient co-author a new narrative about themselves by investigating the history of those values. Narrative therapy claims to be a social justice approach to therapeutic conversations, seeking to challenge dominant discourses that it claims shape people's lives in destructive ways. While narrative work is typically located within the field of family therapy, many authors and practitioners report using these ideas and practices in community work, schools, and higher education. Narrative therapy has come to be associated with collaborative as well as person-centered therapy. Narrative therapy can be applied in sports by instilling skills, values, and knowledge so that athletes give their best. It uses a social approach to therapeutic conversations by seeking to challenge discourses that potentially shape people's lives in ways that are destructive. This therapy is helpful in sports so that the athletes become motivated and achieve the goals set by coaches. How to apply narrative therapy techniques? The therapists will mostly use words or stories. In response to phrasing in words used by the media about athletes can change the way they view themselves, which may adversely affect their performance. This means that words can affect athletes to a great extent. Sometimes what athletes hear about teammates, their teams, and themselves can guide their thinking and actions, and their self-perception. Reality depends on the language used, and there is no objective reality or absolute truth. Besides, reality is constructed via social means. By using narrative therapy, athletes get to analyze their habits, weaknesses, strengths, and patterns. The athlete is able to determine how they view their habits, weaknesses, strengths, and patterns. If they are negative, a therapist can help change them into positive ones through the use of stories, which works to improve the performance of the athlete.